Proceeding with the second session of the day regarding rare disease prevention and supporting care, the first talk is by Dr. Varuna Vyas ma'am about the Center of Excellence and role in rare diseases.
Good afternoon, everyone. A warm welcome to those who have joined late. I'll be discussing the role of centers of excellence in the management of rare disease, and my work has definitely been made easier by Dr. Vyas, who has discussed a significant part about what is the role of these centers of excellence and how they were selected. So the first question that comes to us is, what is a rare disease? As a center of excellence for rare disease, many times we are approached to ask, what do you consider as rare and what will be considered in this policy? So definitely this question is very complex because rare diseases are themselves a complex and heterogeneous group, and individually they are even more rare. And there are varying definitions. Different countries use different definitions of rare diseases. And usually somewhere between 1 to 10 per 10,000 population is what is the cutoff which is being taken for rare diseases. And the prevalence of that disease, whether it is rare in a particular country or not, can vary from the country to country. And diseases are usually not commonly seen in the general population, usually genetic in nature, and most commonly because they are genetic and they are early onset and have a poor outcome. They usually seen in children, and many times these children don't survive to adulthood because of the rare disease. So unfortunately, even many doctors are unaware of rare diseases. We very frequently see that a child with cystic fibrosis is repeatedly treated as asthma or pneumonia before he comes to us, and we finally make a diagnosis of cystic fibrosis at our centers. And for many rare diseases, there is no well-known treatment also. So even when we are able to make a diagnosis, what we can offer is very limited. When a known treatment is there, it might be prohibitive in terms of cost, and sometimes this is not just a one-time expense, and the patient has to spend large amount of money repeatedly throughout the lifespan to be able to lead a normal life. And the data on the incidence and prevalence and cost of treatment and long-term, short-term outcomes, also what this amount of money is spent, we don't have any concrete data on this. And the financial and social support available for these patients is also very limited. There are a lot of challenges when making a diagnosis of rare disease, apart from the fact that there is no knowledge about the rare disease among primary care physicians and general public. There's also that the tests, diagnostic tests are not easily available. They are expensive, and there are patients may take several years before they finally reach a correct diagnosis, and this increases the patient's suffering. And many times the parents have more than one children suffering from the same rare disease before a final diagnosis is made. So this just multiplies their troubles by several times. And it was one such group of parents who approached the court and asked directions to the government that these children with rare diseases should be provided free treatment. And that is when the High Court of Delhi directed the Ministry of Health and Family Welfare to formulate a national policy on treatment of rare diseases. And various committees were appointed both by Government of India and the Government of National Capital Territory of Delhi to look into the matter of rare diseases. And finally, a national policy for treatment of rare diseases came out in 2017, which gave a policy direction emphasized on cooperation between ministries and creating awareness and creating a corpus of sum for treatment of these patients. And finally, the national policy for rare diseases was rolled out in 2021 in its current form. So even though they are rare and they are facing many challenges, we can never underestimate the power of concerned parents, and especially when they join together in such an effort. And most of us as pediatricians are also child rights advocates, and we should work with these parents to improve the outcomes and provide hope to these patients. So as per the current policy of rare diseases 2021, the aim is to provide integrated and comprehensive preventive strategy to enable access to affordable healthcare to patients who have rare diseases, especially those who are amenable to one-time treatment or have a relatively low-cost therapy. And because public and health and hospitals are the same subjects, the central government would encourage and support the states in their endeavor towards screening and prevention of rare diseases, and also work through the centers of excellence under the rare disease policy and the Nidan Kendras that have been established under the Department of Biotechnology. National policy for rare diseases grouped diseases into three major groups. Group 1, which is disorders that are amenable to one-time curative treatment, either through a hematopoietic stem cell transplant or a liver transplant. And Group 2 are diseases which require long-term, lifelong treatment but have a relatively low cost. So, like phenylketonuria, galactosemia, Turner syndrome, growth hormone deficiency. So these patients require lifelong treatment. The cost is there, but relatively low cost treatments are there. And then finally, the group 3 diseases where definitive treatment is available, but the cost of treatment is very high, and hence optimal patient selection is required. And of course, preventive strategies must be directed, because otherwise it is not possible for the government to support and sustain treatment for these patients. So the government notified centers of excellence as a part of this policy. These were premier government tertiary hospitals with facilities for diagnosis, prevention, and treatment of rare diseases. So as I said that we have currently got 13 centers of excellence for rare diseases, and center being the 9th center that was notified. The responsibilities and activities of our center as a COE is, of course, we have created a local committee to receive applications for any patient who requires treatment under the rare disease policy, and we have opened a dedicated bank account for the same, through which we are constantly receiving rolling funds from the government, from the Ministry of Health and Family Welfare. And we provide, and there is a consortium of these centers of excellence which synchronize and work together towards implementation of the policy and providing supportive and definitive care to the patients. We also work on education and training at all levels, screening patients for especially antenatal, neonatal, and high-risk screening, providing diagnostic services, prevention by prenatal screening and diagnosis, and research on the cost of low-cost diagnostics and therapeutics, and we are of course treating patients with rare diseases. Our center was notified as a Center of Excellence for Rare Diseases in 2022 under Dr. Kuldeep Singh. So currently, how these centers of excellence work are we get referrals. The referrals are largely in-house, generated from our own doctors, but these are not restricted. Anybody can refer a patient to us for treatment under the national policy for rare diseases. So like I said, there are 13 centers and we are one of them. Once we receive the application, we confirm the diagnosis and see, or if there is a need to revise the diagnosis, we do the same, and we see whether specific treatment is available or supportive treatment is available. And currently a limit of up till 50 lakh is there per patient. So any patient who meets the criteria for being treated under the policy, national policy for rare diseases, which includes 67 illnesses as of now, the patient can receive a sum of up to 50 lakh in his lifetime for the treatment. So, and we also have a crowdfunding platform, which we'll be discussing later. So we enroll these patients on the crowdfunding platform also, and then we try to procure drugs for the specific treatment, and of course to continue to provide integrative supportive care to all patients, whether they are part of the policy or not. So financial resources, like I said, there is a crowdfunding platform that is available, and patients are enrolled on these platforms, and anybody who wants to donate money can donate money through through the digital portal for crowdfunding. And of course, the government provides a financial support of rupees 50 lakh to the patients suffering from any category of rare diseases. So we have multiple patients who can benefit from these. This include, of course, inborn errors of immunity or primary immunodeficiency disorders. Then inborn errors of metabolism who can benefit from foods for special medical purposes. Then patients who can benefit from growth hormone therapy like Turner syndrome, proven growth hormone deficiency, Addl syndrome, Prader-Willi syndrome. Then cystic fibrosis patients who can get who have to spend a significant amount of supportive care every year. So even that can be supported through this. And of course, we have Wilson's disease, Gaucher's disease with patients who can receive at least 1 year treatment in the fund of 50 lakh rupees can be enrolled through this policy. Other disorders are of course Pompey's disease, thalassemia, cystinosis, and other patients are seen on case-to-case basis, and we consider if they can be evaluated under the national policy of rare disease. And if we don't have a clear answer, we write to the Central Technical Committee of Rare Diseases to take their opinion on whether that disease can be included under the national policy of rare diseases or not. So we have multiple facilities at AIIMS Jodhpur. Most of us are aware we are of course a multi-specialty hospital. We have a daily dedicated genetic clinic. We have state-of-the-art diagnostic services. We have a prevention sector. We are having both kidney and liver transplant facilities. Also initiated hematopoietic stem cell transplant this month. And of course, we are also a research institute. So that makes us quite apt to be Center of Excellence for Rare Diseases. We are currently treating multiple patients, to name a few: Gaucher's disease, MPS 1. We are also giving growth hormone therapy for growth hormone deficient and Turner syndrome patients, treating cystic fibrosis, thalassemia, to name a few. Apart from this, multiple research initiatives are also going on at our institute. We are part of we have a Nidan Kendra under the DBT Umeed scheme. We were a part of the Genome India project. We have a joint collaborative agreement between IIT Jodhpur and AIIMS Jodhpur. We have a health technology assessment center, and we have also got an outreach tribal health center at Addl, and we are actively involved in screening pregnant women and newborns under the National Health Mission. And we are constantly carrying out multiple patient and medical experts educational activities at our center. And we are involved in celebrating various awareness days like Rare Disease Day, Down Syndrome Day, etc. And this is a picture of our satellite tribal center, which was established by AIIMS Jodhpur in collaboration with the Ministry of Tribal Affairs. And we are also providing services to this tribal health center through telemedicine services. So in case we get applications for diseases which are not covered under the national policy for rare diseases, we apply to the CTCRD, and this is the performer where we include the name of the disease and what is the probable incidence or prevalence data that is available for our country, and what are the available treatments and if they are approved or not. And then the CTCRD during the discussion decide whether this particular disease can be included as a part of the NPRD or not, and whether we can provide funding to patients through that. But otherwise, irrespective of the funding, we continue to diagnose and treat a large number of rare disease, much more beyond the number of 67 that are approved under the national policy for rare disease. We work to further strengthen our diagnostic services, especially from the funding that has been sanctioned for each of the rare COEs by the Ministry of Health and Family Welfare. We provide educational and outreach activities, and we are doing research targeting these rare diseases. And we continue to provide integrative and comprehensive care to the patients. And of course, like Dr. Chana said, as we will now be developing the hub and spoke model for supportive and follow-up care, we hope to provide support for that as well. So, thank you very much. There are any questions?